Did you know that up to 80% of people with PCOS have some level of insulin resistance, even if they're not overweight? Now, as a registered dietitian, I see this all the time, but what is insulin resistance? And how does it drive PCOS symptoms like irregular menstrual cycles, acne, and fertility issues? Let's break it down today. Insulin is a hormone that is produced by your pancreas. After you eat a meal, your body will release that insulin, which allows sugar to move out of your bloodstream and into your cells in order to make energy. When you have insulin resistance, your body has to produce more insulin in order for your cells to respond at the same level as it did before. And if sugar can't get into your cells, it means it's just pooling in your bloodstream, which can cause other health conditions, and over time, you can actually die. And that is what used to happen to people with type 1 diabetes before we learned about insulin, how it worked, and how to make it into medicine for those folks. Now, for a while, most people with insulin resistance are able to keep their blood sugar levels in an appropriate and healthy range. However, they're doing it with a higher amount of insulin, and that high amount of insulin can be causing damage to your cardiovascular system. It can be causing you to gain weight. It can just be causing other systems of your body to be functioning in a little bit different way. And that is partially how it contributes to our PCOS symptoms. Science is now really finding that PCOS and insulin resistance have what's called a bidirectional relationship. A bidirectional relationship means as your insulin resistance gets worse, your PCOS also gets worse. And as your PCOS gets worse, it can make your insulin resistance worse as well. So it's this vicious cycle between these two conditions, which makes both of them very challenging to improve. Insulin resistance doesn't just affect your metabolism, it actually impacts your hormone health as well. Okay, stick with me here because we are going to get pretty sciencey. High insulin levels stimulate a cell in the ovaries called the theca cells. Now, theca cells provide structure and support to the ovarian follicles, but they also stimulate androgen production. And androgen production is what makes typically male reproductive system hormones like testosterone. All females are going to produce some amount of androgens because they are the precursor to our typically female reproductive hormones, estrogen and progesterone. In people without insulin resistance, females will create a low level of androgens across the menstrual cycle. And in the middle of the menstrual cycle, the low amount of androgen will allow a spike of luteinizing hormone. And that spike of luteinizing hormone is what tells the body it's time to release a mature egg. Now, if androgen levels are high, we won't have that spike of luteinizing hormone, which means we won't produce or push out a mature egg, which means we are going to experience some disruption in what would be a typical menstrual cycle. And that is something that's pretty common in PCOS patients. Not every PCOS patient has a disruption in their menstrual cycle where they have these really long menstrual cycles or irregular periods because there are different types of PCOS. And if you're not sure which type of PCOS you have, I have a whole video laying out what type of PCOS you might have based on your symptoms. But for many folks, this insulin resistance then causes high androgen production, and that high androgen production disrupts our typical menstrual cycle. And that is a big part of why PCOS patients typically have a difficult time getting pregnant because they're not regularly releasing a mature egg due to these high androgen levels. And those high androgen levels may be a result of insulin resistance and high insulin levels stimulating the theca cells all the time. The thing about hormones is they can actually bind to any cell in the body that has a receptor for them. All of our typically reproductive hormones like testosterone, estrogen, and progesterone, they actually have receptors on cells or tissue types all over the body, not just in the reproductive system. So things like testosterone, estrogen, progesterone, they can actually bind to cells in our brain, in our adipose tissue, in our cardiovascular system, our heart, in our nervous system. We are actually able to experience, and we do experience, effects of our different reproductive hormone levels all over our body. And this is why males typically store most of their adipose tissue or their extra fat in their midsection, whereas females typically store most of their body fat or their excess calories in their hips, their butt, their thighs. That is because estrogen and testosterone can bind to those adipose cells and direct which area of the body is going to store those calories. When females have insulin resistance and their theca cells are producing more androgens, they may also experience this belly fat that we typically see in males because that testosterone is saying, hey, we like to store our excess calories in the midsection rather than, say, in the booty. And that belly fat, again, another typical PCOS symptom that we see in lots of PCOS patients. Now, testosterone can also bind to the skin, and high testosterone levels binding to our skin cells can cause things like hair growth and acne, another two very common PCOS symptoms. And it goes back to testosterone being able to bind on these different tissue types that actually have nothing to do with our reproductive system. Excess testosterone can actually also bind to the pancreas. And remember, the pancreas is where we produce insulin. Binding causes our body to produce even more insulin. So now we have insulin resistance and high insulin binding to our theca cells, causing us to produce more testosterone. And then this testosterone can go around and bind to our pancreas, which then causes us to create more insulin. And this is how that vicious cycle I mentioned at the beginning really happens. Now, insulin resistance and PCOS can also be caused by things like chronic inflammation, stress, and other hormones that impact our metabolism, as well as genetics. But there are some pieces of this that we can manage or we can change, improve with lifestyle management. Some of them might require medication. Now, insulin resistance is why I became a registered dietitian. I am going to give you some of my best tips to reduce insulin resistance in people with PCOS or without PCOS. Now, number one, despite what you have probably been told, I don't want you to cut carbohydrates completely out of your diet. What I want is for you to think about shifting your carbohydrate intake from more of our refined, high glycemic index carbohydrates that are pretty typical, pretty common in the American diet, switch over to more lower glycemic index, higher fiber carbohydrates. So things like whole grains, oats, lentils, beans, fruit, vegetables. I want you to focus more on those carbohydrates and less on your refined grains, things like white rice, white pasta, white bread. I have a whole video that I will link down below that is all about the evidence-based recommendations for diet, supplement, and herbs based on your type of PCOS or the PCOS symptoms that you are trying to manage. Now, number two is you want to be getting regular physical activity. Both cardio and resistance exercise have been shown to improve insulin resistance. A combination of both cardio and resistance exercise is most effective, but I really want you to focus on building muscle mass. The reason I want you to build muscle mass is because having muscle mass and then moving that muscle allows us to pull sugar from the bloodstream without insulin. Muscles are able to work a little bit different than other tissues in the body. So if you have more muscle, they can pull more sugar from the blood when you start to move them. And that is really important because anytime we can clear the blood of sugar without insulin, we are actually improving our insulin sensitivity, which is the opposite of insulin resistance. Now, science says that moving your muscles after a meal for just 3 minutes can actually improve your insulin sensitivity. So you don't need to be doing, really long walks after every single meal if it doesn't make sense for you. You certainly can, but you want to build those muscles and then move them for a few minutes after your meals to really help your body metabolize whatever you just ate. If you are on an airplane or you're in a meeting, a lunch meeting, and you've eaten something, just bouncing your leg or doing a little bit of calf raises, even maybe like moving your arms, if you have muscle and you are moving them, that will help to metabolize that sugar, pull it from your bloodstream without having to do anything else and without using insulin. So have muscle, move them at least a little bit after your meals. Now, those two things, increasing the amount of fiber that you're getting in your body and in your diet, reducing the amount of added sugars and refined grains, and then building muscle and moving that muscle, those things have been shown to reduce your insulin resistance in as little as 3 to 6 months. So if you commit to those two things, over time, you are probably going to see some improvements in your insulin resistance and then maybe also your PCOS symptoms. Now, the third recommendation I have for you is other lifestyle and potentially medical support for your insulin resistance. Now, that might mean getting better sleep, getting more sleep if you are not getting enough or getting high quality sleep. And that is partially because our pancreas just works better when we've gotten enough rest. You may just also need a better system to manage your chronic stress. That might be breathing, it might be going to therapy. Finding a release system that is healthy for your stress can reduce some of the other hormones that can cause insulin resistance. You may also want to explore medication like GLP-1 medications, myo-inositol, or metformin, which are 3 medications that have been shown to reduce insulin resistance in people with or without PCOS. And you can talk to your doctor if those are appropriate for you. Now, personalized medical nutrition therapy, which is just specific management of your PCOS and your PCOS symptoms, done in conjunction with a registered dietitian, has been shown to improve insulin resistance better than doing it on your own. So if you can afford or you can access a registered dietitian, it may be really useful to do so that you can have an educated, science-backed plan and you can have accountability from that dietitian. Now, if you are not able to access a dietitian, whether it's cost or time, I really hope that you'll subscribe to this channel, because that's what this channel is for, is to provide as much good evidence-based actionable information for people who just can't or don't want to see a registered dietitian in person. And if you leave me questions on this video or other videos, I will answer them and I will try to get you as much information and as much guidance as I possibly can. Now, if you're not sure what type of PCOS you have, what type of lab tests you should be doing to get a diagnosis or manage your PCOS, if you're looking for those PCOS specific nutrition tips, I highly encourage you to watch this whole playlist, which answers all of those questions and more, and even has some downloads that you can take with you to the doctor next time you go to help you manage your PCOS as best as possible. As I create more PCOS videos, I will continue to drop them in there. Thank you so much for being here. I will see you in the next one.